Hello everyone, I'm going to be talking about cervical cancer, and did you know that cervical cancer has become a high burden, especially in the low resource settings, especially here in Zimbabwe and in Africa as a whole. And so it's a significant issue that has affected the world at large. It's a global issue actually, and by definition, when they say cervical cancer is the cancer that is emanating or that is arising from the cervix itself, and it is as a result of the human papilloma virus, specifically the type 16 and type 18. And the risk factors of cervical cancer are a lot, but I'm going to be mentioning just a few. Human papilloma virus infection, of course, with the type 16 and 18 is one of the most important risk factors. And then when you look at the Zimbabwean perspective, in the Zimbabwean context, use of African vaginal herbs, of course, has caused the cancer cases to rise. And early sexual debut, where our teenagers are indulging in sexual activities early, has also contributed to those. And of importance, multiparity, where a woman is having more than 5 pregnancies, of course, and immunosuppression with HIV among its men. And for the signs and symptoms, we can actually divide them into early stage cancer and advanced stage, but I'm just going to be mentioning them together. So they, in the first stages, it is asymptomatic, and the woman might be having abnormal vaginal bleeding, abnormal vaginal discharge, which is very smelly foul discharge. And in the advanced stages, there's pelvic pain, there's swelling of the lower limbs, there's unexplained weight loss, and also fatigue. Of course, hematuria might come in as well. And for the diagnostic test in Zimbabwe, we have adopted the VIAC, which has been intensified when we are doing visual inspection with acetic acid to visualize the cervix. And then, of course, pap smear, HPV DNA test, colposcopy, biopsy, and imaging. The scans can also be used to detect cervical cancer. And the management. Under management, we can talk about the precancerous, the early stage, and the advanced stage. On precancerous, we are saying we can have cryotherapy, we can have LIP, we can have conization. And in early stages, we can actually have a surgery where the uterus can be removed or where the cervix can be used, which is trachelectomy. And in the early stages, we can use radiotherapy. In advanced stage, we can actually use chemoradiation, where there's combination of chemotherapy and radiotherapy. And of course, palliative care to just improve the quality of life of this patient. And did you know that after even the treatment, even those treatment in the advanced stages, this patient would actually require palliative care follow-ups and also counseling. The families, the churches are also being involved, coming in to support this woman. And did you also know that we have got imaging issues that are coming in? We have got a human papillomavirus vaccination for the girl child between 9 and 12 years. And then we also have telehealth, where we are actually taking care of women who are distant through the different technologies. We are consulting them using those technologies, and then the screening itself has been is intensified, and also have other medicines that are coming in. And now the role of the midwife and the nurse is to make sure that they sensitize the women, to make sure that they know about cancer, early detection, the 3 delays to prevent them. Most probably the first delay, where the woman should make a decision on time, and then of course to teach other new coming midwives, new coming nurses to know about cancer and those imaging issues that are coming in, and of course to make sure that they health educate the communities, the health educate, especially in Zimbabwe, about the use of the African pitocin. And in conclusion, did you know that cancer of the cervix is preventable? Did you know that with the health education, women can actually stop using the African vaginal herbs and then stop the cases of cancer? And as a community, as a country, we can actually have a healthy woman. I thank you. Bringing health.